views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Public Health America, a 30-minute program on BronxNet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents, but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college, but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer at Mercy College. I am so pleased to welcome our guest today, Dr. David Bell, Professor of Pediatrics and Population Health at Columbia University. David, welcome to the program.
Thank you. I'm glad to be here.
Thank you so much. Pleasure to have you. So, David, I know you've been doing some cutting edge work on young men's clinics and the access that young men have to the utilization of healthcare services. Why don't you set the table for us in terms of the work you're doing?
So I'm an adolescent and young adult physician at Columbia University, and I'm the medical director for our young men's clinic, which I've been the medical director since 1999. And so sort of focusing on adolescent and young adult male health, I've come to realize the focus is important because young men stop seeing their primary care doctors after the age of 15 and don't re-engage with primary care until the age of 40.
That's a long time. That seems like an important gap that we need to address. So I would imagine that part of your work is to try to, motivate the young men to maintain an access to healthcare. Let us know what your efforts are there.
Really? So actually, my premise is that our healthcare services really don't serve them well overall if we take it from just our general perspective. So they aren't dying of heart attacks. They aren't dying of having strokes. Many of the elements are big public health issues that are really sort of killing our young men, as well as sort of their what's making them sort of ill in a certain way. So they're dying of traffic accidents or injuries in general. They're dying of homicides and suicides, and to some degree, no longer, but HIV is a huge, STIs are huge morbidity or huge sickness that sort of is related to their health at this age.
Is your primary focus urban young men? Is it a national thing? What is the catchment area of the work you're doing?
So my clinical work is very much focused on northern Manhattan, basically Washington Heights and the Bronx. I do get clinical patients from all over the city. And even when some of my young men move away, they keep in touch with me. However, my sort of work overall is national and sometimes international.
So with that said, that's very important. This might sound like a deviation from the point, and I don't want it to be. What is the intersection between health and college attendance among the young men you serve? And the reason I ask that is very deliberate, meaning that if they stop going to see their primary healthcare doc at 15, if a young man in the Bronx goes to college, my guess would be their access to healthcare would at least be average. Maybe not the Lincoln or the Cadillac, but not horrible. What's the intersection between the pursuit of higher education and healthcare in the population that you're serving?
That question has a lot of complexity to it that I could go into. I think the base sort of conversation is about social determinants of health, and I'm not sure if your listeners are have heard that term, but social determinants is sort of the baseline of things that come together to help see what helps each individual and sort of culture, sort of neighborhoods be the healthiest that they can be. And education is one of them. So what I would say is that what I do know from an educational standpoint as a social determinant of health, one of those baseline issues, our young men actually aren't seeking higher education as much as we would like to help them out in the sort of larger context of health. How that sort of really plays to college attendance, once they're in college, they usually have access to the college health services. Whether they use them or not is another story. And I think that speaks to the same as whether they're using healthcare services and have healthcare access outside of college services.
So 1 in 3 students that attend Mercy College reside in the Bronx. Obviously, many students that attend Columbia, a national top tier university, come from New York City and beyond, including international. What do we need to be doing with young men in the Bronx and NYC generally to keep them engaged with healthcare and get them to college?
Great question. I think it is complex. I think it's really about engaging with our young men. And I say what I have learned in my experience over my 20 years here is it's not necessarily anything else but a relationship that you build, especially in healthcare, that allows them to know that you care about them and allows that that you have their best interests at heart for their future. From an educational standpoint, I do have sort of educational psychologists that I talk with and that I'm connected with, and they realize that the same thing is important for our young men and our adolescent and young men, is that when they pull back and they're not connected, they're less engaged with their educational space. But what we do from early on is really engage more of the quiet sort of unobtrusive student, whereas guys aren't always quiet and unobtrusive, and our teachers really need to engage with them to figure out how to connect them and connect them to the material that they're teaching.
Very good. Makes sense. So now I'm going to ask the what I call the difficult question. Let's talk about race ethnicity. So the vast majority of students that are going to, or young men that are going to come from the Bronx, NYC, are students of color. The vast majority are first generation college students. Many of their parents may not even be English speaking, even though they might have been here for 50 years. I've been in higher ed for 30 years. I've been at some pretty good schools that have faculty that are devoted to their students. But still, in fairness, the vast majority of institutions I've been at are predominantly white or Caucasian. Right. What do we, talk to me about the difficult, the hard issues, the race ethnicity. How do we engage young Black and Hispanic Latinx men to convince them that there are people waiting in the wings to care about them and to help them with their health and help them in the context of their education? What do we need to do better?
Oh, we need to be out there and engage and have them see role models. One of the true success stories is that Columbia this year has 17 African American young men in our first year medical school class. This is sort of unprecedented for Columbia University and our medical center. And so we're really happy. What it's doing, though, is getting all of our Black doctors together and Latinx doctors together, male doctors particularly, and we are getting together so that we can be a force to support our young men that are coming into next year's class. I would say the same thing, having these even 17 young men come into our class, be those role models for our young men going into college, saying there is a possibility you can not only be here, but you will have young people or individuals that look like you to be in the office when you arrive. And that's, I think, really important.
Tell us a little bit more about the clinic and how it started, what your primary goals are, what you do.
So the clinic started way before I got here. It was started by a social worker named Dr. Bruce Armstrong, and he was a social worker that really put as his dissertation to involve more young men into primary care services, but particularly around their sexual and reproductive health. And so he started the clinic around the early 90s or late 80s. It's hard to sort of put a specific time on it. I joined the program in 1999. And when that happened, we were 4 hours a week for our clinic, and we were seeing 750 unique patients a year. I had a nurse practitioner, a physician's assistant working with me, and social worker working with me. And that's sort of where I started as my base.
That's great. So in the remaining moment or two that we have left, what do you see as the next steps in terms of the evolution of your clinic and how to best reach young men of color to keep them engaged in healthcare and higher ed?
So what we've done so far is we've grown since that 1999 when I started. We've now grown to 5 days a week, and we're full-time clinic with a nurse practitioner and a family medicine doc working with me. We're now seeing 3,400 unique patients a year. So we've grown tremendously, which is the storyline is if you build it, they will come. And it's really about engaging them with a purpose. And that purpose is really to see them as a whole person and see them through not only sort of their traditional health lens, but also the broader health lens. I really aspire and look to mentoring our young men in many ways, particularly around education. I just sort of engaged a young man to re-engage with higher education, and he's interested in med school. So he just asked me for a recommendation. So this is after 2 visits with him. So I'm really happy to know that I've already helped one person and one young man, even recently, sort of move into higher education.
That's fantastic. We're going to take a quick break, but when we return, Dr. David Bell will tell us a little bit about his own personal experience that enabled him to launch a profession and a career as opposed to a job that we've been discussing that is doing so many important things at Columbia University in the Bronx and NYC. This is Public Health America. I'm your host, Dr. William Latimer. We'll see you in a bit. Welcome back to Public Health America. I'm your host, Dr. William Latimer, and it is my pleasure to welcome back Dr. David Bell, Professor of Pediatrics and Population Health at Columbia University. David, in this section, we talk a little bit about your own personal history to kind of, in a way, inspire and let folks know in the Bronx and NYC that everyone faced challenges and nothing was obvious or automatic, but going to college and beyond college is what is so critical to creating a platform for a profession as opposed to a job. So if I may, let's start with, where were you born and what were some of your formative experiences?
So interesting enough, I was born in Texas, a small town, Port Arthur, Texas. It's right on the Gulf of Mexico and right on the border of Louisiana. That area was my father's hometown, and I grew up a couple of blocks away from my grandparents on my father's side. There's so many things to talk about about that, but I think it was interesting, and one of the reasons I'm here in New York is because Port Arthur, Texas was 15 minutes from a Ku Klux Klan town. And it was always this presence in my life that I did not want.
Sure. Yeah, that's awful. And, what does one say to the presence of something that pernicious other than that's so terrible? During your childhood, were you there for most of your childhood? Did you go to public, private school? What was your experience then?
I went to public school, actually went to parochial school. So it's such a small town. There weren't private schools like there are in New York City, but their parochial was basically a Catholic school that costs $10 a month or something like that to go. So I went to Catholic school until 8th grade. And then my brother talked me into going to the public school, high school across town. And that's sort of where I became a bit more interested in science and sort of really gained that sort of foundation in a sense to help me move to college and then to med school.
That's great. Where'd you do your undergrad?
I went to UT Austin.
Sure.
So 48,000 students, undergrads, and 50 something more. It's probably larger than that now, but when I was going, it was incredibly large.
So UT Austin's a great school. It's a great town, and obviously progressive. What was your experience there? What were some of the two-part question. Did you have challenges in terms of getting there? And that maybe no, and that's fine. And what was your experience there? And were there people that were important mentors to you at that time?
Lots of different questions. So I fortunately didn't have that much of a problem getting to UT Austin. It is a public school, public state school. And so I did relatively well in high school. So the sort of UT Austin was relative, especially in 1980, I'm pretty old. It was relatively easy to get in. It's much harder to get in now than it was then. My mentors, they were the unspoken mentor of my father, and I would say, and my mother. I know that we all have different backgrounds, and I do feel privileged that my father was able to his father was a shoemaker and sort of shined shoes. But my father actually, he was born in 1920 and sort of got himself out of Port Arthur and became a physician himself. And his office was next door to our house. We walked out of our backyard, and that was where he saw patients in the neighborhood on the Black side of town. And so that he was sort of my role model and my inspiration. And I'd say it plays into my experience here in New York as well.
Sure. I mean, it's not a point of comparison, but a point of humility, pride and humility. My Lebanese grandmother ran a corner store for 50 years that she owned and operated, and my German grandmother worked for AT&T for 50 years and made sure that their children, my parents, went to college as first generation college kids. Obviously, your dad was a physician, so he really, I would guess, pulled himself up by his own bootstraps and really, rebooted the system in an incredibly positive way. So it's lovely that he was part of your inspiration. UT Austin, where'd you go from there?
I went to another state medical school, UT Southwestern Medical School in Dallas.
Great. And did you know, what was the point at which you said to yourself, I'm going to do what my dad did?
I want to say it was in high school, because it was a weird default, because I was good in science and I didn't like English. Writing.
Don't worry, it's okay.
Yeah,
it's the wrong way. We know you love English. Don't worry about it.
Well, I actually love English now. I'm actually writing poetry. I'm doing a lot of different things that I never did before, but I didn't like it. And science was like, all right, I can see myself doing something science related. Oh, why don't I do this? And so that sort of is kind of the lackadaisical, in a sense, sort of decision I made to go into being a doctor. But then I stuck with it because I really did like working with people, and I couldn't see myself not doing that for the rest of my life.
Sure. And when you went to med school, did you, typically there isn't a specialization per se. When you did your residency, did you have an area of specialization?
So I do want to point out one thing. Yeah. I didn't do well in med school. And not many people talk about what their successes and failures are, but I will say I did not do well in med school, and I failed a class. I also was the last person in my class. But look, I guess my point in telling anyone who's watching this is, look where I am today. They aren't looking back at that. They're looking what I'm doing now and what my capability is. And I think that hopefully that inspires so many of you not to sort of say, I'm not doing well, I can't, but you can, and just keep striving for it.
David, I think that I really appreciate your sharing that. I can't tell you how many times I've mentored students over the years that experienced various utterly normative bumps in the road, and yet experienced them as, and I mean this literally, catastrophic when they weren't, And I think I'd like to believe that a critical piece of the mentoring I provided that you just have done, that I think is so wonderful, is to say, nobody succeeds all the time. For every grant I got, there was 3 I didn't. And if there is any testimony to, a career, it's things like perseverance. It's things like, almost a faith or a belief that you're on a kind of journey that you believe in and you stick to it despite those failures. I think in those moments, to the extent that you've got people around you, whether it's in your case, your mom and your dad, or mine, or mentors that help you put that in context, I think that is also important. So this is my second difficult question. I want to go back to your childhood. You said that you resided in an area that not that far. You've mentioned that in quote, in the black part of town, your dad was a physician. Obviously, that's very impressive. But not far from there, there was a chapter of the KKK. Forgive this question, but what on earth was that like? I mean, that must have just been so unsettling and so just part of of consciousness. I don't see how it couldn't be.
Right. It's hard to describe. It was always present, but because I didn't taunt it and go into the area, it felt less of an issue. Now, that's not to say I didn't taunt it in high school, because I actually went to the town. This is a town, Viter, if it has been in the news and was in the news early on in the 90s, where they dragged a black man behind a truck because he was applying to get an apartment in Viter, Texas. So that's, even in the 1990s, it was still a major problem, as to say the least. But that's sort of what it was always in the back of my mind, but what really wasn't present. I just knew, it just made me know that prejudice and racial issues existed to a major degree.
You know, we live in such a divisive time. I'll put myself on the line for a moment, and then I'll put you on the line. So this is my third. You've now broken the record for difficult questions in public health America. You know, I am probably naive, but I believe that higher education is a way to bring people together from diverse backgrounds and have difficult discussions in a civil way. I'd like to believe that there might be higher education institutions in Texas that are doing that today with young men and young women that come from the town that are doing, you know, that have done that utterly unspeakable, horrible act. What is your opinion about how in the heck do we move this needle forward? How do we bring this great country forward to not be so divisive and so terribly racist?
If I could answer it with one probably trite answer, but it's to understand our common humanity and that we are all the same. Our genes are the same. Our brains are the same. There are some social constructs that really put us in different places and have us sort of interact in different ways. But that is minor compared to our common humanity. And if we can understand that and speak to each other related to that, I think many of our differences will disappear.
I want to thank our guest, Dr. David Bell, Professor of Pediatrics and Population Health at Columbia University. I want to thank our viewers for tuning in. This is Public Health America. I'm your host, Dr. William Latimer. See you next time. Take care.